Welcome everyone to the 10th anniversary of the Down syndrome program at Massachusetts General Hospital. My name is Jenny Brown. I'm a television journalist for the Today Show, Fox News, ABC's Good Morning America. But most importantly, I'm the mother of Will Brown, my 9-year-old son with Down syndrome. And when my husband Ryan and I first learned about the diagnosis prenatally, we were scared. We were scared. And we made a trip to the MGH Down syndrome program where we met with Dr. Scacco and the team to learn more about Down syndrome. And I remember leaving the appointment feeling hopeful. Oh, look at that. And since then, we've returned to the program on a regular basis, traveling from New York each time because of the unmatched clinical expertise of everyone at the Down syndrome program. So beyond Dr. Scacco, Will has been evaluated by the program's physical therapists, occupational therapists, speech therapists, nutritionists, social workers, resource specialists, and all in one place and all on one convenient day. And I'm so happy to share that Will is thriving, attending school. He's in 3rd grade now, and the absolute joy of our lives. So I know I am definitely not alone in feeling so thankful to the MGH Down syndrome program. And I want to introduce another mom, Neely Bassman Hayden, an actress whose credits include Broadway, television, film, print, commercials, concerts, industrials, and theaters across the United States. Neely and her husband, Eric, live in New York and have 2 children. She recorded this special song for us today.
There's a lovely little lady, a muzzle to my skin. She stretched my heart wide open and let herself right in. This tiny little person, just 18 inches long, is rearranging all we'd figured, and we're stumbling right along. She's taking on the household, she's taking on the land, she's taking all our hearts in her tiny little head. She's soaring past the mountains and riding in the sand, a treasure map we've yet to understand. Yes, this little piece of magic came to us from above and hit us like an asteroid of some new kind of love. We're seeing brand new colors and hearing brand new songs on paths that we have tread down all along. She's taking on the household, she's taking on the land, she's taking all our hearts in her tiny little head. She's sailing across the oceans and digging in the sand, unveiling far more secrets than we'd planned. Yes, this lovely little lady, a muzzle to my skin, has stretched my heart more open than it's ever before been. This little piece of magic sent to us from above is rearranging all we'd figured about love, rearranging all we'd figured about love.
Neely, I feel like all of us parents can relate to your song. Our kids They really do rearrange all that we figured about love, as you say. And I know I'm a different person because of Will. How do you feel that Ever has changed you and your family?
Goofball. This is Ever, by the way. She just turned, how old are you? You can tell everyone. She just turned 8 and she's pretending that she's shy. But she's not. How did she change? Well, it's a kind of a double whammy because Ever is my oldest. So she made me a mom. So as you know, everything changed. You see everything. I just remember going on a walk when she was days old with her in a little carrier, and she was the teeniest, tiniest little 5-pound baby. As I sit on there, just 18 inches long and just itty bitty. And I remember going on a walk in our neighborhood in Manhattan with my husband, and excuse my voice, I have a little bit of a cold, and just seeing everything in a new way on this walk, that everything we wanted to show her and just the whole world through a little baby's eyes and what she must be seeing, and everything we wanted to teach her and share with her. And she's changed everything, our schedules, obviously, our priorities, the choices that we make in life. And just by being my daughter, and then by being Ever extra special with Down syndrome, has just opened my eyes. I mean, I just feel like I thought I was a good person before, but she's made me kinder, I think, and much more empathetic and understanding to a world, a community that I really didn't know anything about, and opened my eyes to how uneducated most of us are. And I feel, and my husband and I both feel, a responsibility to share that information about, my amazing child and a whole community that we are not appreciating and understanding. I think I had an idea of like how I could help and give when I have learned. She does have a dog. And now I see how much I have to learn from her, and
Right.
how much she offers her peers and our entire extended family, and how much she has taught us and continues to teach us things I didn't even know that I needed to learn.
Right.
And I think that's the greatest, one of the greatest gifts that she has added to our lives.
And you've been coming to the MGH Down syndrome program ever since Ever was born, basically. What keeps you coming back?
Well, we were very grateful to, oh, there we are. That was actually February 2020, right before the shutdown, when she graduated from the, I don't know, I can't remember, Dr. Scott, go correct me, what it's called, the infant program, or the young, I know, who's that? That's you.
That's me.
And it was such a godsend, especially in the beginning, because we know that we are in good hands, experienced hands, so we don't miss anything. I think that was our biggest thing, is like, we just didn't know what to look for. We didn't know what we needed to get ahead of. And when we were in the program, like you had mentioned, we saw not only Dr. Scott go, but his whole team, the physical therapist, the OT, audiology specialists, everything was looked at. I remember our very first visit there, they did a check for infantile spasms, which we never in a million years would have had.
Right.
And, thank goodness we didn't find any with her, but we just felt in good hands and knew that nothing was going to, slip under the, what's the word?
Slip through those cracks.
Thank you, slip through the cracks, because we had experienced eyes and ears and minds helping us on our team.
And I understand, Ever, you're a model. So, being in the spotlight, just like your mom. Can you just tell us a little bit about that? Because that is just so cool.
Yeah, she's awesome. I think this year she might have worked more than I did. That's you. That's those are two different ads she did for Zara. So she really just kind of fell into it. As you mentioned, I'm an actor and do some modeling, and she was with me when she was a toddler. I brought her with me to go visit my print agents, and they were like, "Hold phone, who is this? Please give us pictures of her." So I gave them snapshots, and she just immediately started, excuse you, immediately
Wow.
started booking work. And not only that, but she loved it. And so I have no reason to hold her back, as long as she's having fun. And as you can see in the pictures, I mean, it's so much fun for me to watch. I know the business so well, but when I see her doing it, I see it again in a whole new light. And the way that she holds a whole room of people, of grown-ups, photographers and producers in the palm of her hand, and just everyone's faces just light up when she gets in front of that camera. You could see her face lighting up in these pictures.
Yeah. Well, thank you both so much for joining us. And Ever, your pictures are just beautiful. Thank you both for being here.
Yeah.
So in 2008, Dr. Jose Flores, who has a sister with Down syndrome, established the Adult Down Syndrome Clinic at Massachusetts General Hospital. And in 2012, MGH expanded this clinic into a full multidisciplinary program for people with Down syndrome of all ages. Joining us now is the Emma Campbell Endowed Chair on Down syndrome and the director of the program, Dr. Brian Skotko.
Jenny, thank you so much for hosting this very special moment for all of us. We really appreciate it.
I mean, I'm beyond delighted to be here, Dr. Skotko. And I know that the past 10 years have flown by for you. They have flown by for me since the moment I met you. But it took a really dedicated team to build the program to what it is today, right?
Oh gosh, we just couldn't have done it without such an amazing team. And I want to thank all of the clinicians, past and present, who have believed in us. Since Dr. Flores established our program in 2006, we have now had 8 physicians who have specialized in Down syndrome. And I particularly want to give a shout out to Dr. Ali Schwartz, who served as our program's co-director in those formative years. And as you know, Jenny, our team is multidisciplinary, which means that we try to coordinate lots of different providers into one day to make it so convenient for families. So rather than having multiple visits to the hospital, we provide everything in that one-stop shop consultation. And this means that everyone with Down syndrome also receives a consultation from one of our nutritionists during their visits. And we've had a total of 6 nutritionists who have been part of our program over the years. And people with Down syndrome have specific nutritional concerns, and our dietitians are there every visit to make sure those patients meet their healthy goals.
Dr. Skotko, I love the fact that every time we come to the program, one provider after another just rotates in and out of our appointment room to see Will, which is just really helpful, not having to make all those transitions to all these different rooms. Can you tell us about some of the other team members that I've been and Will have been lucky enough to meet over the years?
Sure. Well, we also have had 4 social workers who have been part of our program. And as families know, they provide that behavioral and mental health consultation. They assist with the care coordination, and they also provide family support and resources. And one of my favorite aspects is our social workers oftentimes will follow up with these packed emails with resources to families with practical tips so that families don't have to take notes during these visits. Some parents also have questions about school placements and educational supports for their loved ones with Down syndrome. And when needed, our program actually has an educational advocate who has even done classroom observations and attended school meetings. And there also might be indications when a person with Down syndrome has a co-occurring mental health condition, such as ADHD, autism spectrum disorder. So our program has been fortunate to work with a team of neuropsychologists, past and present, who do those thorough neurocognitive testing and make the comprehensive recommendations that are needed in the classroom. And when needed, our team also works closely with a psychiatrist who has expertise in medications for some of the co-occurring mental health diagnoses.
It's funny, you mentioned not having to take notes. I remember our very first meeting, I came in with 10 questions on a legal pad, and you were like, okay, let's get to all your questions. But now I don't have to take those notes anymore. So another
That journalist in you got to sit back and just enjoy the show, right?
Exactly. Now I can just go in and I know someone's going to follow up with me with everything I need to know. And, I've really always appreciated that every team member comes in so prepared. They walk into the clinical room and I know they've done their homework and they're looking to maximize the time together, because and for many people, it's a big trip. We want to maximize all that time. Tell us about that.
Well, that coordinated magic would not be possible without a solid administrative team who really works so hard behind the scenes to make sure, like you mentioned, that curated, customized program is just perfect. For many of our families, the administrative team even organizes same-day hearing tests, Many people will see the ophthalmologist, the eye doctor, and we could even throw a dentist visit in if needed. And for our younger kids, the day also includes same-day evaluation with our expert physical, occupational, speech, and feeding therapists. Families leave with specific recommendations on how best to support the developmental needs of the toddlers with Down syndrome. But as you know, Jenny, the real stars of our team are our self-advocate resource specialists. Ben and Melissa share their experiences of having Down syndrome with each of our patients during each of those visits.
So, all right, I think then it's probably time to hear from Ben and Melissa themselves. Ben and Melissa. Welcome. Can you tell us, let's start with Ben. Ben, can you tell us a bit about what you do in clinic?
Yeah, so I came up with that same question myself. So one of my jobs is to give presentations about different related issues, related to Down syndrome. And the two that I give the most are on sleep apnea and celiac disease. I have both, so I can share my experiences with families. I also can talk about independent living and social activities. I really like meeting the families and talking to them.
Jenny, I have to say, it's one thing for me to tell a family about obstructive sleep apnea, but Ben just goes in there, like he mentions, and says, listen, this is how you wear a CPAP mask, right, Ben? And you get people motivated. So it really is a collaboration.
Yeah, and I have to say, Ben, some of the highlights of our visits over the years have been talking to you about your jobs and skiing and everything you do. So let's talk to Melissa. Melissa, can you tell us a bit about what you do in clinic?
Yes. First of all, I love my job working with Dr. Skotko and Dr. Oshevic. I am the resource specialist at the adult program. We work with the young adults and older adults with Down syndrome. I greet each patient and parents and our caregivers, and we help to take their vitals and bring them to their medical rooms. And sometimes we have this staff meeting called the huddle, where we discuss the patient and what we want to work with. I help with the mailings and some other office work. Sometimes I tell them that I'm involved in Special Olympics and the Massachusetts Down Syndrome Congress. But whenever the patients are nervous or they're waiting in the waiting room because they're anxious and they're nervous, we have this fun box with fun activity books and with toys, so they don't have to be nervous about meeting us or meeting the doctor.
That's great. And it's really clear, Melissa, how much you enjoy your job. Thank you both, Ben and Melissa, for everything you do. I know my son Will just loves to see you when he comes to the clinic. So back to Dr. Skotko. Dr. Skotko, I know that your team works on a strategic plan each year so that you can continue to grow and improve for our families. Can you tell us more about that?
Yeah, I'm so grateful that all the team members are really never truly satisfied, Jenny, and we want more. We strive to do more, and that's because our patients and families deserve more. And we continue to do so, of course, because we have support from on top. So Dr. Ron Kleiman, Chair of the Department of Pediatrics, and Dr. David Sweetser, Chief of the Division of Genetics and Metabolism, have cheered us on from day number one. And our team likes to make changes in very strategic and measured ways. We think of our program as having three fundamental pillars: clinic, research, and education. Put simply, we want to provide the best medical care to people with Down syndrome. We want to be part of cutting-edge research activities for our community, and we want to continue to educate the medical community beyond the potentials and possibilities of all people with Down syndrome.
Okay, thank you for that. And so at this point, I think we should turn to one of those families that have benefited from the clinical services offered by the Down syndrome program. So we are joined now by Roxanne Hoke Chandler, whose daughter Faith has been coming to the MGH Down syndrome program for over a decade. Roxanne, could you tell us a little bit about what makes the clinical services so important to you?
I think it's a lot of things that were mentioned earlier about how I can go one place and see specialists who really know my daughter. And I just, as parents, we talk about all the time, all the appointments we have to make and trying to coordinate them. And there are people there who do that. And just in fact, today I was at MGH and saw 3 doctors in an hour and a half. Like what that does for my schedule, our time, our endurance hours, it just means a lot, and especially when it's run by people who know Down syndrome.
So we know that sometimes the life journey for people with Down syndrome can have unexpected moments. And I know that Dr. Skako and his team have been there for you. Can you share more about that?
Well, I typically say sometimes with Faith, Faith makes things possible and not always easy. And she's had a lot of bumps in the road, but I'm so happy she's here. And back in February of 2021, I took a look at Faith one day and she just looked different. And she talked and she spoke a little different. And I was really hoping for Bell's palsy. And I remember like sending a couple of messages to the Down syndrome team. I'm like, I'm being that parent. Something's wrong. And I'm just being that parent. Something's wrong. And I thought I might be making things up, but I realized that it was much bigger than I thought. And Faith had a stroke. And that was nowhere on my radar of all the special healthcare needs we have, the idea that she would have a stroke. And by the time morning came and I got a call, they said, well, what is your plan? I'm like, my plan is going straight to MGH. You know, there's nowhere else I would go with her. I'm so grateful to be in Massachusetts, so grateful to have being able to get to MGH. You know, like some people have to travel. I jumped in the car and was straight there. And I said, hello, this is Faith. She's in the Downs clinic here. Her records are in there and I know she had a stroke.
Wow. Right to MGH. That's yeah, right to the experts.
There was no other choice for me with my child.
Right. Well, I have to say hi to Faith since she's sitting right there. Hi, Faith. How are you?
Hi.
Good to see you.
Hi.
Faith has gone from being a pediatric patient to an adult patient. So now that you're looking towards the future, what are your hopes and dreams for Faith?
Well, oh goodness, see, this picture does it to me. This is Faith, right? It was after her stroke. So we did some time at Mass General, then went on to Spalding. And I love the partnership there too. It was so seamless. And then weeks later, this was Faith, and I cried. People were like, what's the deal? Like, this is a young lady who just had a stroke, and because of the care that I got, like, this is her now. So it was really amazing. So looking at that picture, I totally forgot the question. I'm sorry.
I wanted to just know a little bit about your hopes and dreams for Faith in the future.
Well, definitely. I do not plan on going anyplace else for her health care. You know, I am interested in the research and the things that happen so that when I look at things in terms of geriatric care for people with intellectual disabilities, that the program grows as she grows with the program. I think about a lot of things of other families who might not have family members and who looks at them in their adult life and their elder life. So I just have lots of hopes and dreams and ways to build the program at MGH and hope that I can be around to see it happen.
Well, thank you, Roxanne, and thank you, Faith.
Okay.
You're welcome.
As Dr. Skako mentioned, another pillar of the Down syndrome program is research expertise. And while clinical guidelines and medical protocols do exist, so much is still unknown about why people with Down syndrome develop some co-occurring conditions. Advancements can be made, but only if research can take place. And the team at the MGH Down syndrome program is at the cutting edge of that research, securing top grants and publishing results that have changed our understanding of Down syndrome. And one area of pressing concern is the investigation into Alzheimer's disease. A disturbing reality is that people with Down syndrome are more likely to develop Alzheimer's disease than the rest of us. So in fact, 50% of people with Down syndrome will develop signs of dementia by the age of 50. But there is reason to be hopeful that prevention and treatment might be available in the future. The MGH Down syndrome program has been a site for groundbreaking clinical trials where new medicines and vaccines are being tested. The program most recently completed a recent early stage clinical trial testing a vaccine that might prevent Alzheimer's disease in people with Down syndrome. The vaccine proved to be safe, and further research is being planned to determine its efficacy. And I am now being joined by the mother of one of the participants in that study, Nancy Clayberg. Nancy.
Yes, I'm here.
Hi, Nancy. How are you? I know that you and your son, Michael, came for many visits to the Research Center for the Down Syndrome Program. I'd love to learn what some of the things what were some of the things you did when you came in for the research study?
No, I need the husband around. I need kids.
Yes, he wants
in the house.
Yes.
No. Rebecca, go.
Okay.
1999. Oh,
Yes.
my age.
Michael was born in 1989, and he loves this CD that talks about music in the 1990s. So
Same, Michael. Same. Love the 90s music.
Anyway, we have been part of the Down Syndrome Clinic, the Adult Down Syndrome Clinic, since it started. And my husband and I got an email, I don't know, maybe 3-4 years ago now, asking if we would be interested in having Michael participate in a 2-year study to investigate the relationship between Down syndrome and Alzheimer's disease, and the administration of a vaccine that hopefully is going to help not only people with Down syndrome that get Alzheimer's, but all of us that could possibly get Alzheimer's. So my husband since has passed, but at the time we were very interested because Alzheimer's is common in my husband's family. His father had Alzheimer's, his grandmother, sister. So we jumped at the opportunity to get involved, and also knowing that Alzheimer's was more common in people with Down syndrome. So we immediately signed up, and the experience for the next 2 years was absolutely magnificent. I would tell my family and friends, I had to take Michael to Mass General for this study, and they would think, oh gosh, what a way to spend the day. And I said, no, you don't understand. It was exhilarating. It was exciting. It was, first of all, Dr. Scott Go and his team made it absolutely one of the most pleasant experiences anybody could ever want. Michael, see, there you are. They were welcoming. They explained things perfectly so that Michael understood exactly what was happening. He would get blood drawn when we would go. He would get a physical by Dr. Scott Go. It involved several MRIs, which Michael tolerated very well. And we also met with Dr. Pulsifer regarding the cognitive part of the study. And then Michael would get a shot, and you didn't know whether you were getting the vaccine or whether you were getting the placebo. As we found out just about a year or so ago, Michael actually did get the vaccine. So he does now have, hopefully if this becomes common for all of us. This is a wedding we were at in Puerto Rico.
Yes, 4 years old.
Yeah, that
4.
You've known the groom since you were 4 years old, and that's my other daughter, Jackie. But anyway, we got very, very, very enthusiastic response. We got welcoming visits to Mass General, and the highlight of the whole thing was Michael's attitude toward this study. He thought he was a celebrity. He told everybody, all our family, all our friends, anybody he came in contact with, I'm doing a study at Mass General for Alzheimer's disease. And he was so proud of it. And it really brought tears to your eyes when he would talk to people about his involvement in this study. So I can't say enough for what Dr. Scott Go, and there were other sites across the country besides Boston that was doing this study, which was interesting because it was a widespread involvement, but it was a wonderful experience for Michael and for our family. And you feel proud that you maybe are doing something that can help people with Down syndrome that develop Alzheimer's, but also the general population, because once it goes beyond the 2-year study in that, which is now ended in Boston, but then now other people will be able to participate in a study to test this vaccine. So we were very, very excited to be part of it. And we would certainly do something like that again.
You know, I as a mother, of a son with Down syndrome, I worry a lot about Alzheimer's too. So I want to thank you and Michael for participating in that study. You know, you're really helping advance you know, what we can all learn, as you mentioned, not only for our loved ones with Down syndrome, but for members of the general public. Thank you, Nancy, for joining us today. Thank you, Michael, for joining us today.
I need a question for you.
Yes.
Disney Plus.
Oh, he loves Disney Plus. That's his favorite thing in the whole world, right?
Me
Michael?
too.
This one. No.
Disney
Oh.
Plus, 90s music. You're hitting all my sweet spots here, Michael. Thank you. As Dr. Scocco mentioned, the third pillar of the Down syndrome program is education. The program has a long history of giving medical students, genetic counseling students, nutrition interns, pediatric and medical residents a learning experience in clinic. They get to observe the team in action while also learning from the patients with Down syndrome and their families. Many students go on to do extended rotations and work on formal projects. One such person is Dr. Dan Katz, one of the pediatric residents at Massachusetts General Hospital. Dr. Katz, I understand that your first experience with the Down syndrome program was as a medical student. Can you tell me a bit more about how you met Dr. Scocco and what your first project was like?
Absolutely. Thanks so much for having me, and thanks for leading this incredible celebration. So I met Dr. Scocco 5 years ago from 3 days from now. I looked at the date, and it was during a conference on disabilities here in Boston, completely unrelated to MGH, unrelated to school. I just happened to be there. And there was a healthcare panel that I went to, and he was one of the speakers. I knew I was looking for a research project, so I went up to him afterwards and asked if we could work together. And it kind of, long story short, it took a year to plan, but a year afterwards, so 4 years ago, I spent 2 months full-time as a researcher in his program. And we had 2 main projects during that time. And the first was this really incredible quality improvement project where I got to interview parents of children with Down syndrome who also have a specific type of epilepsy. And what we did is we wanted to make sure that our clinic aligns with the parents' goals and creates a safe space for them and is really able to create a strong partnership. And so I'm really grateful for all the parents who took time to talk to me about their experiences with getting diagnosed and treated and going through that really challenging diagnosis. And now that work is published and hopefully helping other clinics, other parents kind of go through that same process. And then the second project was along the same lines. So for people with Down syndrome and that type of epilepsy, we did a review of all the medical literature and published a summary so that everyone has one specific place they could go to look at what do we currently do, diagnose, treat, et cetera, for all those patients.
So you have observed patient visits in the clinic. Can you tell us, as a developing physician, like what do you gain from that experience of observing the patients in clinic?
Yeah, so I can read about Down syndrome all I want, but in the end, nothing is better than learning from parents and patients because they are the real experts. Doctors can write about it. I can go and read, but in the end, they're the ones who live through it and know every little detail of what it's like. And I remember the thing that really struck me the most about the clinic was how all of the doctors, social workers, dietitians, all of the therapists, the resource specialists, administrative staff all work together and with the parents and patients at the core of the team so that we're working with families to help them go through their healthcare journey rather than kind of making decisions and telling them, but they're really the ones who lead the team. And I really loved seeing that, loved learning about their experiences, how kind of they've interacted with other doctors, and seeing how important it is to have specific specialists that know the ins and outs of Down syndrome to kind of catch anything that might go on with the kids.
I understand, you mentioned two major projects that you've worked on, but I understand your work has nowhere near stopped. You're working on something right now, trying to map the lived experience of people with Down syndrome around the globe. That sounds fascinating. Tell us a little bit about that, please.
Yeah, it's a really incredible project. I've been really lucky to work with Dr. Skotko for 4 years now, and I'm going to stick around as long as he'll have me. And so this really wild idea he had right before we met, fortunately for me, and he wanted to figure out how do different countries support people with Down syndrome, because in the end, the genetics are the same and the medical challenges and societal challenges are similar, but how do different countries accommodate those and work with them? And so he put together an international group of parents, researchers, and doctors. And together we spent about 2 or 3 years putting together a survey to measure how different societies support people with Down syndrome in a few different domains. So in education, community inclusion, how independent they are, healthcare, and policy. We spent another year sending that survey out to different Down syndrome organizations around the world and collecting data. And now we're really at the exciting near final steps of processing all the data and getting at least near publishing it to see how can advocacy organizations take this information and advocate for very specific improvements that need to be made for people with Down syndrome. Do people in some country have enough access to heart surgery, or do they have supports for having a job in an inclusive environment? And then also we can use our data to find the countries that do it the best and use them as role models to help other countries get better. And it's really exciting knowing that this is going to be a long-term project where we keep coming out with new versions, new questions, and track progress over time too.
It's such fascinating and important work. Thank you so much, Dr. Katz. I'd like to bring Dr. Skotko back into the conversation before we bring the program to a close. Dr. Skotko, so many team members have touched so many lives. What has growth been like for the program?
Jenny, our program is proud to take care of 750 active patients with Down syndrome. And we see couples prenatally, as you remember, and we also take care of their loved ones with Down syndrome from when they are babies all the way throughout their whole lifetime. This makes our program really special. We're not just a pediatric clinic. We're not just an adult clinic. We are both. But now we're at full capacity, meaning that under our current funding mechanisms, our team has now needed to actually establish a wait list.
So can you tell us about how the funding for the program actually works? I don't think people realize how it works.
Yeah, an unfortunate reality is that medical insurance doesn't fully cover the costs of our team's components. In fact, we need to raise about $640 for each patient visit in order to cover all the aspects that medical insurance just simply does not reimburse. So each year we need to raise about $550,000 to keep our clinic functioning, but we've been able to do so because of generous families. And I cannot say enough how grateful we are for these partnerships. Every donation, every size really does make a difference. And our team simply cannot and would not do this alone. So we continue to build and preserve this program together with our donors.
And I understand that you're also building an endowment to preserve the program in the long term.
Yeah, that's exactly right, Jenny. Our main focus right now is securing $14 million in an endowment. The interest from such an endowment would continue to support our program's expenses forever. This would mean that 50 years from now, 300 years from now, we would still guarantee there would be the cutting edge Down syndrome program at MGH, continuing to make that clinic, research, and educational advancement. I'm so proud to say that right now we've raised $6.1 million from wonderful families who share this goal. And I'm going to continue to work hard with our families to find those remaining amounts.
Thank you so much for, for this important work and preserving the program. It's it's essential, right? Not only for the patients seen by you and your team, but I also know it will be crucial for continuing to maintain the virtual program that we covered at Good Morning America, called Let You Launch, called Down Syndrome Clinic to You.
Yeah, a stark reality is only 5% of families around the country, let alone the world, have access to a specialty clinic like ours. The rest of people with Down syndrome are dependent upon their primary care providers for medical care. Yet we know that most primary care providers have maybe 1 or 2 patients with Down syndrome at their practices. Therefore, it is unreasonable, if not impractical, to expect that these primary care providers can stay up to date on all the recommendations for people with Down syndrome. So this is why our program built Down Syndrome Clinic to You, or DSC to You. Now, caregivers from around the world can simply log into our webpage from the comfort of their own home, enter any concerns or questions they have about their loved one with Down syndrome, and they'll get instant customized health and wellness information. In short, we're coming to the families so they don't need to come to us.
That's amazing. And you've demonstrated that it's already making an impact, right?
Oh, yes. Our team has actually studied this platform for over a year. Those families who utilize the system were able to keep their loved ones with Down syndrome more up to date on all the recommended care. Primary care providers also said they appreciated having these streamlined tips and recommendations. And parents have told us that they've appreciated the ease of use. But Jenny, our work is not yet over. Our mission is to democratize healthcare so that all people with Down syndrome can have that same level of care. And until we reach every family around the globe, our work is not yet done. But someday, one day, we're going to get there.
Absolutely. Thank you, Dr. Scocco, to you and your entire team for your dedicated passions. Congratulations again on your 10th anniversary. I know that the future for people like Will is even brighter because of the efforts that are underway. We'd like to end today's programming with a special recording. Neely Hayden will be singing the lyrics to Someday by Alan Menken from Disney's Hunchback of Notre Dame. The piano accompaniment has been recorded by Grant Campbell, a person who is seen in the MGH Down syndrome program. Take it away, Graham and Nilly.
Someday after